Marcus J. Cage. I'm your host, Marcus Cage. On this episode, I want to talk to you about the healthcare system. Recently, I was watching one of my favorite independent YouTubers out there, and he was covering healthcare. He was covering British citizens trying to guess the price of healthcare costs and healthcare procedures in America. And I just thought it was really interesting, so I wanted to have a little fun with that, show that to you, and then just talk about it a little bit. Hope you enjoy. See you on the other side.
For a baby!
Is there a price for that?
Yes.
Jeez, $100? $200?
$2,500. $80. $600.
$250.
More.
Shut the fridge.
More.
£300. $600. $600.
Yeah. Ambulance call out. How much do you think that costs?
Zero payment.
Zero payment?
Yeah, zero payment.
No. Because $2,500.
For real?
Yeah.
Oh, okay, cool.
you look. An inhaler.
$100.
Yeah, you're pretty close. A bit more.
$120.
250 to 350.
For an inhaler?
Yes.
Man. So if you're poor, you're dead.
I know that it's like public healthcare in the UK. In the US, fortunately, I'm able to get healthcare through my parents, their jobs, but like I carry an EpiPen, and I know that like the cost of that has just been rising. So like there's like very few companies that even compete, so it's sort of like a monopoly for the EpiPen. Even though like we have insurance, it costs my parents about a couple hundred, even with insurance.
So 2 EpiPens. Okay. How much do you reckon they are? $80. $600.
$40.
I'm afraid not.
More?
More?
$100.
More.
$150.
More.
$250.
More.
Shut the fridge.
More.
£300. $600. What? Why?
That's a very good question.
$600.
Yeah.
For me, it's more like just hives and shortness of breath. Yeah. So it wouldn't be like an immediate death situation, but like, so I've been fortunate I've not had to use it, but it's something like keep on me. Like I have my backpack right now, I have it on me.
Cost of childbirth.
Jesus. 50 grand, something ridiculous now?
Yeah, see, I've blown the figures up on your head now, haven't I? Because they're larger. It's the highest, generally speaking, is about 30 grand.
Okay.
Is that reasonable? You haven't?
Not reasonable at all. It's just like now we're on like we're on a benchmark.
100, 200.
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand for a baby.
Well, I guess. How much is your child worth?
Yeah. What, is that like the same everywhere?
Yeah, the average is about $10,000. Yeah.
That's mad. Oh, no thanks.
Okay, no thanks. In which case, the coil, IUD, contraception, how much do you think that costs?
For one person to implant $1,000?
Yeah, a little bit higher.
Really?
Yeah, $1,300.
Oh. Mental.
I wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Okay, is there a price for that?
Yes.
Jeez, $100?
$2,500.
For what? Why? Why?
Give birth by C-section, and you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah, you have to pay to do that.
Yes.
To hold my own child that I've been carrying inside of my womb.
Say something else.
I was.
But yes.
Jeez.
It's not actually that expensive.
Right. Charging me, I'm gonna punch you.
Yeah.
Not you, but the doctor. Like $100.
$40.
$40.
For skin-on-skin contact. What do you think of the NHS?
Literally the gift that keeps on giving. Literally, people are so dumb for taking advantage of it, and I don't want it to change.
Finally, does it make you grateful for the NHS?
Absolutely. I mean, I didn't know how much free healthcare we got, like, just off the bat, but, like, knowing you have to pay like 30 grand for a child, it's outrageous. It really is ridiculous. So thank you, NHS, for your hard work.
I'm genuinely speechless.
Presumably you had an idea that healthcare was expensive in the US.
I didn't realise how expensive. Yeah, I'm just like, what? Like, if you don't have money, you're fudged, yeah.
What do you think of the people who are profiting off the sale of these medicines?
You bastards. Sorry, beep. I think, I think they should be stopped. Fuck Trump.
All right, what did you think? Now, listening to those, listen to those British citizens and looking at the reactions on their face, how shocked they were at our system. Doesn't it make you feel just a little bit silly that we even argue to defend the system? I mean, I guess I could go into a whole lot of talk, but if that didn't convince you, I don't really know what else to. I don't really know what else to say. I mean, myself personally, in the military, I basically was under universal health care, just like they described. I didn't pay a dime. I went to the doctor. I was treated for whatever. If I was sick, if I needed preventative care, all of it was taken care of, and it was already pre-done through taxation. We're the only nation, only modern first world nation that does not do this. And yet we pay the highest amount. My only question for you is, why do you think that is? Why is our system so much better and a better way to do things if nobody else wants to follow us? If nobody else wants to do it the way we're doing it, why is our system so good? Why are the candidates who are against these systems truly against them? I mean, if I was able to travel multiple places in the military, as a diplomat, I'm pretty sure I'd be able to travel multiple places also. Sitting congressmen, governors, mayors have all kind of conventions and summits and go all kind of other countries, talk to all kind of world leaders. They understand these systems, but they're lying to you. I'll leave it at that. Hope you guys have a good one. Hope you enjoyed. Please comment, like, share, tell your friends, anybody. Have a good one.